Hey, this is the next episode of the Ben and Gary Show, We Know Dentistry. And I guess we're here to talk to you guys about the last meeting that we went to, yet another digital symposium. This one was sponsored by the dental implant company, Straumann Dental, and they are out of Sweden, and they are one of the premier dental implant companies that we have today, and they put out terrific products. And we had a wonderful symposium that was a one part of two that will be actually going on the West Coast later on in the year. And this one was right here in Washington, D.C., and we were very, very excited about being able to take our clinical team and allow them to share in our experience as we move forward in the frontier of digital dentistry, as we make our change from the analog world into the digital world. And that's what we really want to be here to talk to you about, is kind of like what we found and sort of just go through the whole flow of why we were interested in this. And it really is about the going from the analog world where we actually had impressions and things where Goop was in patients' mouths.
You didn't like impressions?
Yeah, impressions were, who really likes doing that, So it's simply a newer, a cleaner, a fresher, better way of being able to capture an image or capture a tooth so that we can create restorations in a more efficient manner, in a more modern manner, and hopefully more accurate.
Yes, it's really incredible what they can do with scanners now. So part of what we have to do is acquisition. So we have to get information from the patient, not just of course their name and address and all that, but also the facial features. We have to get the pictures of the arch, both the upper and lower arch. So we can do all that with scanners. And sort of intraorally, we scan the teeth, and then once the teeth are prepared, if we're doing a crown, we can scan the crown preparation itself. So no more
Goop.
Yeah.
So the Goop, nobody likes Goop. Goop is not something that you really want in your mouth, and there are going to be times when they're still going to be necessary to use, so we can't 100% get away from it. But boy, we're making fast tracks away from that. Yeah. And then what that's really opened us up to, what's going to these meetings here, they introduce you to things that you didn't really think about, things that you just sort of intuitively have to understand, and it comes through experience, but yet it's very subjective. And so the idea is to take something subjective and try to make it more objective, so therefore you can more consistently deliver a great product, as opposed to it just being totally about the art. Now, we're never going to get away from that artistic value. I don't want to get away from that artistic value. That's what we bring to the table. That's what we as specialists want to be able to bring to a patient, this individuality and uniqueness that we can capture. But, with digital, it allows us to capture a patient's facial features and understand how that fits into their smile. And these are things that we used to take just analog pictures of and try to extrapolate information. But what we're finding these days is that once we're sort of getting into the digital world, this digital medium, that there's greater analytical capabilities so that we can quantify an actual result. And it really comes down to is we're able to, in this world, being able to share with the patient and how they're going to be, how they're going to look before we're actually ever doing it. And that's the beauty of what this does, and it allows us to be far more detailed and scientific in our process.
Right. So what we have to do then is, once we gather the information via intraoral scans and the CAT scans or the CBCT, say we're doing a implant case, those are two different files, so they have to be merged, and they have to be able to talk to each other so that they can understand certain points in the scan of the intraoral scan and also the CBCT, so that they merge it and are able to define exactly where that point is that we want to place, say, an implant or the crown. And it allows us then to better treatment plan and then put that plan into action. So it's much more efficient, and it makes all the planning so much easier.
Certainly, yeah. It decreases our variability and allows us to be able to capture sort of a file that we can reference at a later time. And, listen, a picture is worth 1,000 words, and that's what we're really talking about, is that we're capturing a more detailed picture. In the analog world, that was capture a picture by either taking a film photograph, also perhaps using, as we've already mentioned, actual impression, which then needs to be poured into a stone replica or a cast of what we're trying to work on, and so that is doesn't it takes away some of the variables, I think, that are so important to delivering a great product. And with the digital world, it just certainly allows us to be able to merge all of that data together and then be able to share that with all of our colleagues throughout the process, whether it be our laboratory technician, who often really never gets, traditionally I should say, the laboratory technician never gets a chance to really see the patient. And one thing in our office, having the ceramics in our office, and we kind of gotten around that, but this digital world makes that even far more efficient and easier to accomplish. And then also our technician gets to be able to walk away with that same sort of chairside information that we intuitively understand, and then be able to interpret that while they're creating lifelike, unique restorations for a patient that fit their face. It's kind of hard to do it when the patient's not there. Well, this digital world essentially allows them to virtually put that patient in front of them and be able to deliver on exactly how it's supposed to be ideally done. And that's just the medium and flow that we're going to be going to, that the industry is already making moves towards. And very few people here in the dental world actually can treat a patient digitally from start to finish. This meeting was really devoted to that, so that we can see how this actually integrates and find out maybe where the jumping in points are for us, and what makes most sense. And I think what we've gathered is that it's about the acquisition, which means we're talking digital intraoral scanners, small cameras that capture images. And these days, that's really fabulous, because the software is so powerful, so fast, that if you can imagine, in our iPhone cameras, when we're taking a panoramic view, essentially what you're doing is taking multiple photographs of the same image, and they're using data points that they could match up and actually stitch those images together and to create a one more uniform picture. Well, if you can envision that of a three-dimensional object, a tooth, what they're doing is using a camera, small little end, to be able to take multiple pictures at a very, very fast rate, and they're able to stitch those data points together to create a three-dimensional object. Man, that blows me away when I think about that, on how that actually can happen, and that would actually have your computer to be able to crash in the process while it's capturing all this data, processing that data, and then giving us a three-dimensional view of what we just actually did. And being able to measure it in so many ways, sands, tongue, cheek, saliva, it allows us to be able to really see. And often, if I may look away from look at the TV screen while we're actually doing something directly, which is a different sort of thing, because we're so used to looking at something directly.
Right. One thing that struck me was at the very beginning of the lectures, they showed a picture of a pair of glasses, and right where the your lens of the eye would be, they had some, I don't know what you call it, but it was a gadget that would then the surgeon would wear, so that when they were actually looking at the patient, it kind of peels away the skin. Not it peels away.
It basically allows you to superimpose a three-dimensional radiograph while you're looking at the patient. So envision you being able to take a digital radiograph, a digital 3D object, in order to, or a 3D file, in order to, we talked about these robotic, dental implant, ability to be able to place a dental implant with a robot.
Right.
Well, that robot still uses a scan file that will be on a separate screen, and then as you're doing it, if you're working along with it, look at the screen in order to be able to see what you're doing, almost like a laparoscopic sort of surgery that orthopedic surgeons do on a routine basis. However, imagine if you could look directly at a patient, but as you're looking at the patient through the glasses, you're also allowing to be able to superimpose that same radiograph actually on the patient using these glasses, which allows you to be able to work in both mediums, digitally as well as also analog, looking at a patient. and be able to see what you're doing and have that related directly to what's really there in terms of on a radiograph.
Yeah. So just like knowing that that's out there,
it was amazing.
It's incredible, right?
You know, and they gave another example which was so cool about, imagine if a surgeon is doing a medical or a physician being able to do a heart surgery, and you're looking at the heart, but you can't really see all the vessels. But they actually have scans, of course, where they would have placed dye in the patient to be able to see where all the vessels are. That might be on a separate screen. Well, something like this with these glasses would allow you to be able to superimpose that view on the actual, say, heart. So as you're about to make an incision, you can see exactly where all the vessels are. Wow. That just kind of made us all speechless when we saw that. We'll take that technology and allow that to be used in dentistry, implant placement, endodontic treatment, and it really almost in any kind of way you can envision that this would be the next the wave of the future. So if you were looking for a wow in the beginning of a seminar, that was a wow for us, and totally got us into the whole into the our mindset of listening to what the future was going to be like.
Right.
So we were just stoked and gassed about the idea of being able to do that. So hey, what do you have next? So the next thing was, well, how do we get into something like that? Well, for us, it's simply most likely scanning a patient, it's getting rid of the goop and going right to multiple pictures that are stitched together that gives us a 3D view of what's going on, and that actually it was able to work off of.
Right, because it can be very intimidating when you look at the big picture, and if you do everything digitally, that can be intimidating.
Yeah.
So this meeting allowed us to kind of decide where we want to jump from analog to digital and back to analog, and so we have more of a game plan now as far as how we're going to do this, and all this will benefit the patient to a much greater degree, make things much more comfortable and much more time efficient.
So thanks to Straumann for having the wherewithal and the vision to be able to create a seminar, a symposium such as this. We've never encountered anything like this before, where it was soup to nuts, top to bottom, understand how you get into the digital world, what's possible, and then how do we start. And that's I think what you're talking about in terms of the intimidation factor is that you can get all of this wow technology and then figure out, like, hey, we're over here on this side of this analog world. We're in the world. You can't just go get from everything from start to finish at once. Most likely it would be cost prohibitive for us to do that, but just from a understanding on how to use the technology, it would be overwhelming. So you kind of have to really put your toe in the water. For us, we kind of figured that out to be where the acquisition is. Right. And we've already seen from the last symposium that we went to in Arizona what's possible with robotic implant placement. That's another wow factor here, but that's just one moving part, one cog in the wheel of the digital workflow that we've learned is all possible and new. But gee, where do you start? Just that robotic implant placement device there. It's a Yomi. If you got a spare 200,000, I think that'd be great. If we can go ahead and get that, and just think of that as just one cog in the wheel of this whole process. That it just gets to be very challenging to figure out how you enter into this world. But hey, listen, we're going to go in full bore, but we're going to do this very smartly, and really that's where we are at this point in time to know how best to do that. We've got our game plan. In fact, actually, we have the guys from 3Shape coming pretty soon to be able to give us a demo on our first scanner. So hey, get ready, it's coming.
Yeah,
I'm excited. Our team was just from our laboratory technicians. This meeting was really geared towards surgeons. It was geared towards restorative doctors, and it was geared towards our laboratory support.
Right.
And listen, we brought our whole clinical and laboratory team with us. And everybody was really kind of moving forward on the frontier. And listen, we can't just learn this information and bring it back and expect everybody to understand it. We're kind of a team in this office at Smiles International. We move forward, or together we don't really move forward. And so that's it was so important for us to inspire all of us in this process, because there's just so much to learn, so much new stuff, and so much exciting information that we're gonna have to just get up to speed. We've got our homework cut out for us, and it starts with, for us, I guess, digital acquisition. I've already given a shout out to Straumann and saying how wonderful it was for them to be able to put together such an awesome symposium. But that doesn't happen without behind the scenes. I really am close to the individuals who who were part of the behind the scenes on what was most important, most likely, is what our audio visual was looking like, and how impressive it was on two very large screens to be able to see the guys from DevRite here. That's Brody Hildebrand and Will Martin that were just fabulous in their process. Will just put together a just terrific presentation, along with Adam Hamilton, and those two really blew us away as the first ones to be able to get up on the podium and speak. And in addition to, both of those individuals are part of the team that puts together and coordinates the audio visual for the meeting, which, it sounds kind of simple. It's not just turn on the mic and turn on the projector. It was create a background theme that was just, it was a common thread throughout all the speakers, that the presentations were just incredible. And one of the things I actually also heard was that from some of the speakers there, that they have never had such wonderful treatment and support at a meeting. And I'd say that that's, one, because of their expertise of these individuals, but two, they're also speakers as well. They're also prosthodontists as well, who understand what's necessary to be able to present at the highest level and be such a professional, and realize that there's a void in the market for that, and that not all meetings are created equal, and not all audiovisual companies are created equal. But this, to me, seems to be the next wave. The bar has been set pretty darn high, and they're the ones at the forefront. So thanks very much, Will and Brody. You guys killed it.
Yeah, it was a great meeting. Very impressive. So that wraps up our edition of the Ben and Gary Show.
Yeah, we know dentistry.
We know dentistry. So thanks for joining us. Please send us your questions, and we'll be happy to answer them.
Awesome. Take care, everybody.
Be well. Happy 4th.
Yeah, happy 4th.